Part of our role as a community nurse is to go in and offer education to GP practices, to the nurses, to the doctors, and we discuss with them the importance of 6 monthly blood monitoring. And we encourage that if the GP practice is going to use their blood test form, then they do the full set of bloods that are needed to assess the liver health, and that would be your liver function test, an alpha fetoprotein and a hepatitis serology, and to copy the Hepatitis Foundation and if they're not going to use our blood test forms. But we do post blood test forms with all that included to the client. Sometimes the clients go to their GPs and their GPs will decide to check their liver, but it is really important to stress the point that they need to include full bloods. At present, we have 10 registered nurses working for the Hepatitis Foundation of New Zealand, covering the North and the South Island. We work autonomously, but we also work in partnership with primary and secondary care to promote, maintain, restore health for those people living with chronic hepatitis B. We take into consideration the cultural and socio-economic backgrounds of our clients to ensure appropriate interaction and sensitivity is given at all times. Like all community nurses, our role is very diverse. We mainly provide care for clients, like I said, living with chronic hepatitis B. We offer support and advice. We provide an outreach service for clients that are hard to reach clients and clients that find it very difficult to get to a lab. We will visit them in their homes and provide blood taking. We will take their bloods. We will also screen any family members that have not been tested for hepatitis B. Then what we'll do is the blood tests that are taken, or if the client has gone into the lab, we will monitor those bloods. We will have a look at the bloods, and if those bloods are abnormal, we can refer to our clinician to review, and then clients can be referred on to specialists if need be. Probably one of the largest role we do is education. So we provide education to the clients and their family, if wanted, about hepatitis B. We also provide education to secondary and primary care facilities. We provide information in the community to community agencies like meatworks, cleaning companies, anybody that wants information regarding hepatitis, we will go and provide that education. We do a lot of networking to raise the awareness of hepatitis, the importance of testing people and referring people. We work in partnership also with hospitals, like specialist hospitals. So specialists in the hospital, if their clients are they're not attending their appointments, then those people can contact us and we will go and visit the client and find out why they're not attending their appointment and encourage them to attend. Clients can actually self-refer themselves, and they can do this by phoning the Hepatitis Foundation or emailing us. GPs and other health professionals can refer via electronically, and that's like via Care Select, via HealthLink, via Best Practice or MedTech, or they can email us directly. Once the Hepatitis Foundation receives a referral, either from self-referral from GP or another agency, the nurse that covers that area will be notified that that client has been newly enrolled, and then what happens is the nurse will make contact with the client, introduce herself, discuss who she is and what her role is, and then she will offer the client information around hepatitis B in a time that is convenient for that client. If the client consents to education, then the nurse will make a time that is appropriate, and she can provide this education either by going and doing a home visit or by telephone, whatever the client would prefer. When she has the first consultation, she will do a thorough assessment, and some of the things included there is the client's level of knowledge about chronic hepatitis B, a medical history, past medical history, any medications the client's on, any family history of liver cancer or liver disease. She will also discuss with the clients any other family members that could be potentially at risk and need to be tested. She will provide this education in a way that is suitable for the client. And we can use things like flip chart. Some people learn better visually, some people learn better by listening, whatever is appropriate to that client. If the client English is their second language, then we have got access to interpreting services through our DHBs, and we can involve an interpreter if the client wishes. She'll also offer screening to other family members and household contacts, and she will work in partnership with the client and family to formulate a care plan that is appropriate to the client's needs and is going to achieve the best liver health outcome. Chronic hepatitis can cause serious liver disease in 20 to 30% of people that have it. Chronic hepatitis B is one of the leading causes of liver cancer in the world, and early detection through 6-monthly blood monitoring is the gold standard of care to achieve a positive health outcome. Part of our role as a community nurse is to ensure our clients are having their blood tests every 6 months. And if a client is overdue to have a blood test, that's where we will contact the client, discuss the importance, re-educate if we need, and encourage that client to go to the lab and get their blood test done. A lot of our clients don't think, like some of them, there's lots of barriers of why they don't get their bloods done. Some of these barriers are a lot of our clients are very transient, so they move around a lot and they don't receive that blood test form in the mail. Other reasons are, like convenience. They work 2 jobs and they can't get to a lab. Like they only have Sundays off and the labs aren't open, so they can't get to a lab. Other reasons is chronic hepatitis B doesn't really make you feel sick, doesn't really make you feel unwell, and there's no real symptoms, so they don't think it's important, and some clients just don't value themselves enough to kind of like care for themselves and go and get their bloods done. So as a nurse, as a community nurse, it is so important for us to educate these people, encourage them to go to the lab, and if there is a barrier, we will go and do their blood test at home. Early detection can pick up serious liver problems. If serious liver problems are picked up early enough, they can be treated. We are going to work in partnership with GPs, secondary care, to make sure our clients are getting 6-monthly monitoring and the results are being followed up on. And to let the people out there know that community hepatitis nurses are available to work in partnership with them to provide education, support and follow up with clients with chronic hepatitis B.